All right. So you think that there might be a reason to be afraid of a new drug war resurgence, I guess you would call it, or a crackdown on the legal marijuana industry in the states that have legalized marijuana. If you thought you had a reason to fear that with Sessions, well, then I guess this new guy would probably make you fear that even more. We're talking about Tom Marino, Trump's pick for drug czar. And now, drug czar is an office in the government that should probably just be phased out. But we'll talk about that along the way. As a matter of fact, I have a lot to say about this situation here, so we're just going to get right into it and read the copy. There's a couple different stories I'm going to pick from here. We got the fix, whatever, addiction and recovery straight up. So I guess this is coming from people that are in the rehab game, maybe. I don't know. I'm not familiar with the publication. So as our next drug czar, Marino will influence the country's approach to drug policy. Under Obama's drug czar, Michael Botticelli, who preferred the title recovery czar, the administration distanced itself from a, quote, war on drugs rhetoric in favor of a public health approach. As a congressman, Marino authored the Transnational Drug Trafficking Act, a piece of legislation attempting to decrease drug trafficking across borders, and another more controversial bill attempting to curb drug abuse by increasing cooperation between prescription drug distributors and the Drug Enforcement Administration. Both pieces of legislation are completely not what you think they are. But anyway, the second one, some say it actually protects drug distributors from prosecution. It was signed by Obama last year. In 2016, Marino promoted a national program of mandatory inpatient substance use disorder treatment for nonviolent drug offenders. He explained his colleagues at the May 2016 hearing, one treatment option I have adopted or advocated for years would be placing non-dealer, non-violent drug abusers in a secured hospital-type setting under the constant care of health professionals. Once the person agrees to plead guilty to possession, he or she will be placed in an intensive treatment program until experts determine that they should be released under intense supervision, whatever that means. If this is accomplished, then the charges are dropped against the person. The charges are only filed to have an incentive for that person to enter the hospital/prison, if you want to call it. Wow. Let's look at that for a second here. So this guy here wrote a policy, or not, this isn't a policy he wrote. This is what he's going for, to treat non-violent drug offenders last year. I don't get it. So this is a program he wants to have going nationally, and it's like a mandatory program. This guy's got a R next to his name. He's a Republican. I thought Republicans were for small government. This sounds like this is the most ridiculous big government thing I've ever heard of. So you're going to take people that are nonviolent drug abusers, whatever that means, in your definition of nonviolent drug abusers, that could be a whole range of people that use drugs. And that could mean a whole range of different drugs that you're talking about them using. I mean, you can talk about how many people are abusing their prescriptions. You know, I don't know. There's so many things that you can... This is just ridiculous. Huge government just to figure out who these people you're talking about are. And then you're talking about having this new facility where it's like some treatment / hospital, your words, hospital/prison. What the fuck is that? Hospital/prison? So you're going to lock people into a hospital essentially just because they have a nonviolent drug abuse or use problem? And they're non-dealers. We've seen that too. non-dealer, non-violent drug abuser. That is so broad. But then again, it's not all inclusive either. I don't get it. So then you're going to have these people are going to be released under intense supervision. Well, that's like almost, you're talking about like a probation officer type thing or something. I don't know. I mean, this is all really weird because it sounds like you're asking for billions and billions of dollars to be added to the already increasing and bloated DEA and overall drug war budget. But this would be something else. You'd almost have to create a whole new government agency just to oversee this monstrosity of a government program that you're talking about that would be so massive that I don't know if we could even afford it. I mean, Republicans can always afford things that include bombing people or, locking people up. But this is just a bit too much. This is just a bridge too far. I don't think anybody would be on board with any of this ridiculous, huge government bullshit there, Mr. Marino. Yeah, look at this guy. He really looks like he cares about people that are addicted to opioids. He don't. He protects the pharmaceutical industry. We'll get into that in a minute. This guy is a pharmaceutical industry's best friend in the government. And he wants you to be able to, get as much opioids as you want to get. If you want to go to the doctor and get some opioids for your stubbed toe. He says it's under the guise of, there's people with actual cancer and stuff out there that need these opioids. And, therefore, we got to protect the drug companies from getting busted. We got to make sure the DEA don't know about certain things that go on. Well, like I said, we'll talk about that in a second. What about marijuana? As for marijuana laws, Washington Post Christopher Ingraham outlines Marino's voting record in Congress, which reveals that he's not too kind on marijuana issues. The congressman voted against a measure that would loosen restrictions on CBD oil cannabidiol, a non-psychoactive derivative of a cannabis plant that has been shown to ease seizures in children. In fact, some states that have passed medical marijuana laws allow only CBD oil because it helps without the high, which is ridiculous. I've talked about this in several of my videos. That's just absurd that you would want to ban a medicine because you don't like the high that it gives you. Meanwhile, the same people that talk about this THC high are the same people that they're like back here protecting pharmaceutical manufacturers and sellers from prosecution or from getting their medicine or from getting the DEA to tell them that they can't distribute, which would hurt them more than any amount of fines. So Marino also voted against a measure that would allow Veteran Affairs physicians to recommend medical marijuana to patients, as well as a measure to relax federal restrictions on hemp. Both of these should be separate sentences because they're both different, but they're ridiculous. I mean, it could even be in the same bill, but I doubt it. But I mean, this thing with the Veterans Affairs physicians. So the Veterans Affairs doctors' hands are tied. They can't recommend medical marijuana to patients. But what's even more damning, and what I even hear more about, is these same doctors that are supposed to help veterans, they're out there telling veterans that if they catch them, they find out they use marijuana, they're going to cut them off of whatever other pills that they're allowed to use, or whatever they have to take. And this could involve stuff like diabetes medicine and stuff, I've heard. Definitely inhalers for people with asthma. And then the hemp thing. Come on. What are you talking about? You're talking about hemp. And of course, up here you're talking about CBD. Both of those things don't have anything to do with the THC-based high and the marijuana and the DEA's, asinine designation of it as a Schedule 1 narcotic, which is reasonable in every sense of the word. But yet you sit here and act like We should restrict hemp, or we should restrict CBD. I'm getting to why this guy is so against everything that has to do with the marijuana plant in a minute, but we're going to read the rest of this. He also voted more than once against a measure that would prevent the Department of Justice from interfering in medical marijuana businesses that are legal under state law. Even though it passed, we know that anything that has to do with these protections is basically riding on, majorities of public opinion. So I guess wherever this guy hails from, it just doesn't even matter. Oh yeah, Pennsylvania. Yeah, Pennsylvania is pretty right-wing when it comes to marijuana laws. They're pretty prohibitive in every sense of the word. All right, the congressman told a reporter last fall that marijuana legalization is a states' rights issue. I think that was the afterthought that he was given after he said something about the only way I would agree to consider legalizing marijuana is if we had a really in-depth medical scientific study. Hey, buddy, I don't know what you've been doing. If you really care about this, you would know that there's a lot of scientific studies. And I'm guessing because you're a Republican, you really are into Israel a lot, because they seem to be really super into Israel. Well, since that's the case, you should know that they have a astounding medical marijuana program there, and they've done more research and development in Israel than any other country. But actually, the United States has also done R&D on that since the 60s, and basically there has been pretty in-depth scientific and medical studies. And it doesn't involve producing pills, but that's what he says. If it does help people one way or the other, I don't know what that's supposed to mean. If it helps people one way or the other, then produce it in pill form. It's been tried. And we're going to see it tried again, apparently, with the pharmaceutical companies out there that are developing these single cannabinoid medicines like Sativex and other things. We're seeing what the long-term effects of those products are. But the basic idea that I'm going for is that you need all of the elements and not just one cannabinoid at a time. And making synthetic cannabinoids probably isn't a good idea. I think Mother Nature got it right the first time. All right, now this guy's also, besides being corrupt, that we know he's corrupt, he's a complete shill for the pharmaceutical distributors. We'll get more into that in a minute. But 20 years ago, this guy, I guess, when you got a friend in the government or something, you can get something done or whatever. 20 years ago, elected District Attorney Tom Marino hand-delivered a request to clear the criminal record of Northern Pennsylvania car dealer Jay Kilheeney, a man Marino called a friend who was convicted 6 years earlier of delivering 2 grams of cocaine. Now, as it turns out, this expungement never was allowed to happen or whatever, but that's something, that's something that this guy did. And I don't know if that's like grounds enough for people to vote against his appointment or whatever. And by the way, I think he's pretty much his appointment's pretty much signed, sealed, and delivered. He already put the paperwork in for to leave his post as a congressman. So, they called it judge shopping. They talked to the judge. He wasn't really willing to say a whole lot, in fact. So, you really can't hang this one on him. Judge Brown refused the expungement request, ruling he had no authority to grant a petition for the expungement on a conviction for a delivery of a controlled substance. Less than 3 weeks later, a near identical request was submitted to Judge Anderson. So this is what they're talking about when they say he was actually judge shopping. And, he'll deny it, but that's clearly what was going on. All right, there's a lot to this article here. So I'm going to get to it in a second. Real quick here. More in details about those 2 policies that I don't know if he authored them. Well, anyway, he has authored 2 recent successful drug policy bills, but both have their critics. The 2016 Transnational Drug Trafficking Act expands the ability of the U.S. prosecutors to use extraterritoriality to go after international drug traffickers. But while the law is touted as aiming at kingpins, but observers south of the border have argued that the law targets people on the lowest rungs of the trafficking ladder, i.e. Colombia's coca farmers. So just like in in America, where you got Colorado and then Michigan and other states trying to crack down on, small time individual, really tiny grow operation growers, instead of actually just making laws where everybody can participate in it. Because they're favoring the big time people, the people that want to have the big facilities and make the big money, because they're the same people that used to put you in the big house for doing this marijuana crimes crap. But what we have here is the same thing. Let's not worry about anybody that's actually making money doing this shit, because they've already paid their bills. Who's the people that haven't paid up? Who haven't coughed it up, when we come around looking for our money? Oh, the little guy on the ground, the coca farmer. They probably can barely make ends meet doing this work for cartels and government bosses and shit. So he was also an author of a key supporter of a 2016 Ensuring Patient Access and Effective Drug Enforcement Act. One quick second back to the Transnational Drug Trafficking Act. Remember when the first thing I read, they were some kind of rehab place or something like that. They were pro Obama's guy was the rehabilitation guy instead of the crackdown guy or whatever. Well, they didn't really say anything about this Transnational Drug Trafficking Act. They just said, it had some critics. But all you had to do is include one more sentence, and it would have explained pretty clearly what the problem with that is. Anyway, so this one here, its supporters characterize as balancing the need of patients, the pharmaceutical industry, and law enforcement, but which critics describe as a means of undercutting the DEA's ability to hold pharmaceutical drug distributors accountable for the diversion of large amounts of opioid pain relievers. And as we've seen with Insys Therapeutics, that's what their game is. I have no idea how this is happening, and then they point their finger at marijuana all the time. But these kingpins of the opioid world are basically pushing this shit out there and avoiding DEA, and still getting insurance companies to pay for it somehow. It's unbelievable that they get away with this shit. Well, here's half the reason why, is because bills like this. In the fight over that bill, Marino, the chairman of the House Judiciary Committee on Regulatory Reform, clashed repeatedly with DEA Office of Diversion Control head Joseph Ranazizi. In a 2014 conference call with the congressional staffers, Ranazizi warned that the bill, backed by the Pharmaceutical Industry lobby campaign, would protect corporations engaged in criminal activity. The bill passes the way it's written. We won't be able to get immediate suspension orders. We won't be able to stop the hemorrhaging of these drugs out of these bad pharmacies and these bad corporations, Rosini recalled telling them. What you're doing is filing a bill that would protect defendants in our cases. So the DEA was already working on a bunch of cases where, they followed the ladder up to the manufacturer of the pharmaceuticals, and, and this guy's like, no, we don't care, So Ranazizi's like, yo, our case is right. Some of these guys that you're making this for, our case is right now that we're working on. You're going to make these guys go free. I bet you I wonder if that's a coincidence. Ranazizi's opposition infuriated Marino, who ripped into the veteran DEA's official's boss then DEA Administrator Michael Lionheart at a congressional hearing later that year. Quote, "It is my understanding that Joe Ranazizi, or Ranazizi, whatever, I can't get that thing, a senior DEA official, has publicly accused we sponsors of the bill of, quote, supporting criminals," unquote. Marino said, "This offends me immensely." Oh, you want a violin for that? Come on, man. Offends you. The truth offends you, huh? That's pretty sad. A week later, Marino and Representative Marsha Blackburn, Republican from Tennessee, demanded that the Justice Department Office of the Inspector General investigate Ranazizi for intimidating members of Congress. Ranazizi was replaced and retired in October of 2015. So that's what you get for being honest and telling the truth and speaking truth to power. As frustrating as it is, you have to do it. And whatever happens after that, thank you for your services. All right. If his legislative legacy is an indication, Marino will be the sort of drug czar who is tough on Colombian peasant farmers, but not so tough on U.S. pharmaceutical and opioid manufacturers. Okay. And then you got Kevin Sabat. You know who he is, the professional prohibitionist. He says, "My understanding is that Tom has a deep understanding of the issue and is excited to get started." He, of course, he's praying for a crackdown on marijuana. He's praying for it. So here's how corrupt this guy actually is. The ONDCP declined to comment for this story, and Marino's office did not respond to multiple requests for comment as well. So you're not going to hear from them. Now, what is the ONDCP? It's the Office of National Drug Control Policy, which he will be the director of. And they don't really do much. They just kind of talk a lot, and then shit happens behind the scenes. Like, they say something, and then Nancy Reagan will be the next person to say it, and then later on, Ronald Reagan will come back and quote the drug czar for saying it first, and then Nancy Reagan will come back and say it again. And that's what drug czars do. They don't make policy, and they don't enforce policy, and they don't really do anything other than talk shit. So he came to the job after pulling in big money for an industry that is producing and distributing the nation's most deadly legal drugs. He has received more than $150,000 in donations from the pharmaceutical industry in his political career, including $71,000 for the 2016 election, according to records at maplight.org and opensecrets.org. The data show Marino has received more money from the pharmaceutical industry than any other sector. So that's who he listens to the most, is the people that give him the most money. As the nation faces an opioid crisis fueled by the mass production and marketing of addictive prescription drugs, some physicians fighting the epidemic view Marino's possible ascent to drug czar as a betrayal of rural communities ravaged by opioids, many of which voted overwhelmingly for Donald Trump. Well, another side note, this guy was a Trump supporter from the get-go. This is the opposite of draining the swamp, said Dr. Andrew Kaladny, the co-director of opioid policy research at Brandeis University and co-founder of the Physicians for Responsible Opioid Prescribing, PROP, told the IB Times. Now, one thing I'm going to say here real quick is when it comes to draining the swamp or not draining the swamp, I think they just made some kind of a thing where you don't get to know what kind of visits there are at the White House. Like there used to be open visitor log, and now they're shutting that down. So now you're not going to know what kind of swamp monsters are roaming in and out of the swamp anymore. Just thought I'd put that out there. So in the midst of a public health crisis, Trump is putting at the helm of the ONDCP someone who has worked for the opioid lobby against efforts to bring the epidemic under control, which is very true. In fact, that the legislation I mentioned earlier is obviously a crude, just blatant sign of that. It is hard to overstate how deadly the opioid epidemic has been for Americans. Since 1999, the number of overdose deaths from opioids has quadrupled, as did deaths from prescription opioids like OxyContin, fentanyl, and hydrocodone, according to the Centers for Disease Control and Prevention. Many experts blame the rise on the makers of opioid prescription drugs like the Big-Pharma, the creator of OxyContin, which pled guilty to misleading doctors about the drug's addictiveness and agreed to pay a $600 million in fines in 2007. 3 Purdue executives also agreed to pay a total of $34.5 million in fines. Drops in the bucket, man. Come on, cost of doing drug deals, I guess. But I was talking about incest therapeutics. Same thing. Somehow they get caught doing all that same shit, duping the DEA and the insurance companies into paying for the shit, and the DEA not even knowing about it because they're not getting the right information to say, hey, this patient has cancer or whatever, And then next thing you know it, incest gets a DEA's approval for a Schedule 2 on a marijuana synthetic. What the fuck? I mean, what? Aren't you still under fucking FBI investigation? How the fuck are you getting, the ability to keep, researching and R&D and new drugs? When you're killing the fuck out of people with the drugs you already have, I don't get it. Oh, you know what it is? It's the corruption. I forgot. So this epidemic was created by the pharmaceutical companies. Georgetown University's Dr. Adrian Fu Berman told IBT he is the director of Farmed Out, a group that advocates for responsible prescribing practices. Man, if you think this epidemic is fueled by anything else, you are drinking the Kool-Aid. I remember Jeff Sessions talking shit about fentanyl, and then he kept qualifying it as Chinese fentanyl or fentanyl that the cartels were smuggling in. Man, that's the same bullshit they tried to scare you with Al-Qaeda was getting smuggled in through the Mexican border, or ISIS was going to come in through the Mexican border. Come on, man. What is this right-wing fairy tale bullshit anyway? So here's your deaths from prescription drugs in the United States. Look at this. As you go from year to year, you can look at each one of these and see where there's a case or a new piece of legislation or something that helped them push more of this shit out of their warehouses. Because these guys are just stacking this shit up in their warehouses and trying to figure out new ways to get the fucking shit out of there. And what's that doing? It ends up on the street. It ends up in the morgue, in people's systems that are dead from this shit. The epidemic has only intensified since Purdue's guilty plea in 2007, and now cities and counties are bringing lawsuits against drug distributors, the companies that sell the drugs wholesale. The 3 largest distributors, McKesson Corporation, Cardinal Health, and AmerisourceBergen, which together generated $430 billion in 2015 and accounted for 85% of the drug distribution market, have agreed to pay $230 million in fines to the federal government and opioid-plagued West Virginia since last December. The fines were connected to charges that the companies failed to report suspicious orders of pharmaceuticals. You're talking about the 3 largest distributors of the most deadly drugs on the planet, who make almost $500 billion in 1 year, had to pay a measly $230 million. Are you fucking kidding me? This is like paying a $5 fee to walk into a keg party or something. It ain't shit. Come on, man. According to maplight.org, all 3 companies have given multiple campaign donations totaling between $13,000 and $15,000 each to Marino, who wrote legislation that made it harder for the DEA to take companies off a registry that allows them to distribute controlled substances. If the companies were dealt this penalty, they could potentially incur a far greater financial hit than the fines. You think? Do you think that's true? I mean, come on. They made $500 billion in 1 year shoveling pills out their warehouse. Now you're talking about they kick a few $1,000s over here to this guy and all of a sudden he's their little lapdog? If I was this guy, I would be asking for way more bribery money. But then again, then it would start looking like actual bribery then, wouldn't it? This is fucking absurd. And obscene, by the way. Marino introduced 3 versions of the Ensuring Patients Access and Effective Drug Enforcement Act between 2014 and 2015. before H.R. 471 passed the House. In the Senate, Orrin Hatch, Republican from Utah, who received more money from the pharmaceutical industry than anyone in Congress between 2010 and 2016, introduced a companion bill. The legislation eventually signed by President Obama last year, but not before DEA Deputy Assistant Administrator Joseph Ranazizi had a conversation with the congressional staffers that provoked the ire of Marino, who said Ranazizi told staffers that the bill's sponsors were supporting criminal. And they were. They were directly getting people out of charges that were in court at the time. So we know that's true. During a congressional hearing, Marino told, well, we already heard all this. Yeah, he's so offended. Yeah, why don't you go to your safe space, man? Come on. When the truth hurts so bad, maybe you should stop fucking lying to people. Or making bills. You know, this is another famous thing that Republicans do. What was that bill called again? Ensuring Patient Access and Effective Drug Enforcement Act. Basically, you can look at that and be like, okay, they're ensuring that people can get as much dope as they want while tying the hands of the DEA Act. Because that's basically what it was. Marino has made it very clear that he is on the side of the opioid manufacturers, FarmOut's Fu Bergman told IB Times. The bill he supported made it hard for the DEA to go after distributors and wholesalers of drugs. The DEA was having its hands tied even before Trump got into office, but this appointment will make things much worse. It could also put Marino in tension with others in the Trump administration. Last March, Trump convened the first meeting of the President's Commission on Combating Drug Addiction with Opioid Crisis at the White House. The commission is led by New Jersey Governor Chris Christie, who dedicated the last year of his increasingly unpopular governorship to fighting the opioid crisis, who he governs a state that is home to 14 of the world's 20 largest pharmaceutical companies. Governor Christie speaks to supporters in West Des Moines, Iowa, January 31st, 2016. Oh, wait, sorry. Yeah, my thoughts on that is I don't think Chris Christie really did much to combat the opioid epidemic. I got a million reasons why, but we're just going to leave it at that, all right? If you want to fight with me in the comments section about it, then feel free to go at it. Tough on marijuana. As a drug czar, Marino's job would be to coordinate the drug policy across a variety of unrelated federal agencies such as the Department of Homeland Security, the Justice Department, which houses the DEA, Health and Human Services, and the Department of Education, according to former drug czar Gil Kurlikowski. The job is breaking down the silos and bringing together all those assets so they can coalesce around a mission. Wow, that sounds kumbaya. I don't know if I believe it. He served as drug czar under Obama from 2009 to 2014 before becoming U.S. Customs and Border Protection's commissioner. He told IB Times, "You also have to be the bully pulpit of being part of the White House." All right, I don't know. We already heard about his votes on marijuana. So he voted against allowing Veterans Administration doctors to prescribe marijuana. I just can't get over that one. I mean, it's not even that they were prescribing marijuana, like I said, because if they're not allowed to do that, especially in a state where medical marijuana is legal, then as a patient and a veteran like me, you go anyway and do it. And then if they tell you, well, you can't do our drugs anymore. And I'm like, bravo. You know, they had me going down, the Veterans Administration had me going right down that road of opioids. They started me out with like Norgestic Forte, whatever the fuck those are. Moved on up to Darvocet. And then on over to Vicodin. And that's pretty much, you know, then they wanted to get me off of Vicodin, so they put me on Tramadol. That shit ain't even right, man. I don't even know what Tramadol is, but that shit does not work for pain. For me, at least. It's garbage. But, you know, all throughout those years, I was already using medical marijuana on my own. And as soon as I was able to produce as much marijuana as I actually needed, then I never took those pills again. And I think that was back in the mid 90s. So anyway, and this is where they couldn't prescribe it in states where it's legal. I understand all that. But do they take a hands-on approach and say, well, we're going to kick you right out of all the things you have to do with the Veterans Administration if you do the marijuana? And that's just wrong. You can't do that. If they were pushing that to be the narrative, then they're wrong. I don't know. There's nothing more else I want to say about this guy at the moment. But this quote right here is one worth noting. We have, let's see, who is this? Kolodny? I'm not trying to figure out who this guy is, but I'm not looking too good at it. Can't find it. But anyway, many people in the regions of the country hit the hardest by opioid addiction epidemic voted for Trump, Kolodny said. To the extent that many of them voted for Trump because they felt Obama failed on the opioid addiction epidemic. I expect they will be very upset by this choice. That's true, man. I think that is a very true statement. That there is people that have their backs against the wall and they've seen some of the shit that happened during the Obama administration's when he was president. And to be honest, let's just call it for what it is. Those things that they seen during the Obama administration that were bad for this thing here, that was the shit that probably we can just lay right at this guy's feet. Tom Marino and his bills to basically protect pharmaceutical companies from for people even know what they're doing with all their pills. We don't know what they're doing. We know they have warehouses that need to get emptied. Because you can produce these garbage synthetics and these opiates in the lab all day long. There's nothing stopping them from doing that. Well, this is what you get from that, man. Everywhere you go. 20 deaths per 100,000. 19. I mean, it's ridiculous. 15, 17, 13. These are numbers you see on anything else, and they call it an epidemic that's killing this country. It's an emergency status. We need to do something fucking now to fix this problem. And the more right wing you go, the fucking more deaths you find. Through the Bible Belt, it's just beat red with an average of 20 deaths per. This is what Republican policies are doing. I mean, I'm not blaming it all on their policies. Like you said, Obama and this guy, when he was a congressman writing laws during the Obama administration, Obama signing it, well, whatever. Lay it at Obama's feet then. I don't give a shit. But these right-wing policies have dumped the prescriptions on people like, salt shaker from the sky. Meanwhile, you ban marijuana as hard as you can and push it as far into the black market as you can, even though marijuana use for pain, you look at a state like Michigan where medical marijuana is a thing. The more medical marijuana is prevalent, the more dispensaries they are, as you see in the bottom of the state and near the middle of the state. That's where all the dispensaries are in Michigan. Out here on the west side of the state, in the middle, that's where the least amount of these deaths are. And then you go to where there's hardly any dispensaries, and that's where the most amount of deaths are. And this is the way it is in states as well. So, the Republican policy of ban marijuana as much as you can. It ain't medicine. It don't help with pain. It's not good for seizures. CBD is garbage. All that crap that the Republicans are spewing, fuck them. That's not compassionate. And this is what they're selling you. This is the kind of shit they want you to buy into. They're selling you this deadly dream of opiates. The doctors, their backs are against. They don't have a choice. They know marijuana is the key, but they don't have a choice in these red states. You even mention marijuana to a patient, and the fucking feds kick your fucking office in and raid you. But this Tom Marino guy, This is another one of Trump's famous picks. Find the worst possible fucking guy and put him on the job.